orders, and this create some annoying response for the dentist. Parents may become a barrier between a child and a dentist. And when the parents are in the operatory, the child always divide her attention between the dentist and the parents. And same goes for the dentist. Dentist attention is also divided. So coming towards the classification of a child behavior, there are basically 4 types. In type 1, that is definitely negative. These are the childs, when they come in operatory, they clench their mothers in their mother's lap, and they are frightened and they are shouting. They are definitely negative childs, and they definitely needs a lot of behavior management. Type 2 or the negative, yes, they are coming in an operatory, but they're still in their mother's lap and they're not willing to sit on the dental chair. They also need behavior modifications. Type 3 is a positive child. The positive child means that he is ready to sit in the dental chair. He's opening his or her mouth for a checkup, but maybe he is not allowing us for the further work. So we are supposed to apply some of the behavior modification with the positive child as well. But a definitive positive child is a child who allows to work in oral cavity, and he opens his or her mouth when he is in the dental chair. This is Wright's classification of the child behavior. Understand? Definitely negative, negative, positive, and definitely positive. So behavior guidance is basically when you are guiding someone to improve their behavior. It consists of different steps, and you are creating a relationship between the dentist and a child. This is known as behavior guidance. When it comes to the adults, again, this is known as behavior guidance. You are building a trusting relation between the dentist and a patient, or a dentist or a child, when we talk about the periodontics. There are certain objectives for the behavior guidance. It establishes an effective communication between the dentist and a child. ऐसा नहीं है कि your patients come in the clinic, बच्चा है और you make him sit in the dental chair and you start working. No, always try to communicate before. Always have a good communication with the child. Always try to ask open-ended questions like his school, his class, his friends, and everything like this. This will start in a communication between the dentist and the child. This will gain the child and the parents' confidence. When you take some interest in the child work out in his hobbies, in his timetable, this will make both of them confident, the child and the parents. And by this, you can also teach the parent and the child the positive aspects of the preventive dental care. The aim is to teach. Our aim is just not to fill and work. We are also to teach the child and the parents for their subsequent future dental care. Definitely, when you're communicating, you're talking, that will be creating a relaxing and a comfortable environment for the child and parents. So there are certain techniques starting from the basics towards the advanced, or we can tell the family about the pre-appointment behavior modification by showing the child's different videos of the treatments, and by guiding the parents that we're going to work this for the next appointment, and you can talk to the child and make him more comfortable. And then the communication. Behavior shaping begins off a tell, show, do technique. We'll talk in the next slide. Desensitization, modeling, and contingency. So other methods are distraction, voice control, hypnodontics, coping, relaxation, and home. We'll talk about in detail in the further slides. So behavior shaping is when a child is guided through a step-by-step protocol until that desired behavior is achieved. So this is behavior shaping. You start from the basic and move towards the advanced until the child behavior is achieved. In this very picture, you can see that the dentist is showing a handpiece to a little baby, and a tell show do technique is being followed. First, she tell her that what she gonna do, and then she's showing her the handpiece. Okay, with this handpiece, I'll do your job, and then she'll work. Tell, show, do technique. With this, the child can be more comfortable, and he can sit in the chair because he or she knows that's what's gonna happen for the next. So tell, show, do. पहले उसको बताएं what is the procedure, then उसको दिखाएं, and then do it. Then desensitization. Desensitization is basically modeling. It's a training procedure to reduce the sensitivity of the patient to a particular anxiety producing situation. Like in this picture, the dentist is operating a child that is very positive, and he's a choti bachi, she's looking the dentist and the child, and this is known as modeling, that the child is getting treatment and he has no pain, and this girl is getting prepared for the next appointment. So this is known as modeling. When a child of the same age is being shown to the patient who has to be worked next. For this kid, girl, she has a next appointment, and this boy is doing modeling for this girl to make her show that this is painless procedure and everything is going fine. Understand?
Yes, sir.
Okay. Allowing a patient to observe one or more individuals, models who demonstrate appropriate behavior in a particular situation. Like this is modeling. I showed you in this picture, like this guy is doing modeling for this picture. Like he's been showing her that everything is fine and everything is in control. Then there is contingency management. Good behavior is rewarded while the negative behavior is ignored. Like you can say good girl, good boy, when he or she is opening her mouth and she is cooperating with you. But if she screams, he shouts, you're supposed to ignore this behavior. Distraction is in which you can divert the patient attention from the unpleasant stimuli in your operatory, like the handpiece sound of the or an injection. That can be the music in the background, and that can be the TV in front of the child, and that can be the 3D eyeglasses that has been using nowadays, that a child can watch movie while he's being worked with the 3D glasses. This is distraction. So distraction is diverting the child's behavior or attention from the unpleasant stimuli. Then voice control, certain times you have to control your voice. Sometimes you have to be soft, sometimes you have to be hard with your voice, depending, like certain commands like stop crying and pay attention. If the child is crying, you can certainly say stop crying. This will create some emotional and mental effect on the child, and he will definitely stop crying. This is voice control. If you guys don't understand, you can ask me in the middle so I can repeat. So we talk about tell, show, do, we talk about modeling, then we talk about distraction, and then the voice control. Then hypnodontics is a particular state of mind induced in one person by another. In this state, suggestions given by another are easily accepted. You are supposed to create some storytellers scene that can, like you have to hypnotize the mind of a child by your stories, by fairy tales, and some other uh, stories you can tell to the child. You can change the state of the mind of a child by telling them the stories. Like the fairy can give you the gift, and there are angels, and whatever story you have in your mind, you can create that story for the easy induction of the mind of the child. And then the coping, it consists of distraction, as we talked in the previous slides, that in distraction, we usually distract the child by giving her the 3D glasses, by playing some cartoon character on the TV, and then, or either by a background music. And then allow the child to express her fears. Talk freely with her for her fears, what he or she feels when you're working, and maybe allowing parents in the operatory. Sometimes this also reduce the stress of a child when you allow their parents in the operatory. Relaxation, it involves series of basic exercises that may take some time to learn or to reduce the tension. And when there is increased tension, definitely there will be increased pain. And when the tension will be decreased, the pain percentile will also be decreased. And the relaxation will include home exercises. It's a hand over mouth exercise. You are supposed, if the child is shouting, you can keep your hand over the mouth of a child and then press it. So this is home technique. You understand?
Sir, ये दोबारा explain कर दो please.
Okay, when the child is anxious and he or she is screaming or shouting, and you have other childs in outside the waiting room, so you are supposed to use, these are the relaxation exercise based upon the home, hand over mouth exercises. You're supposed to keep your hand or napkin on the patient's mouth so that she cannot shout and scream. These is also a kind of a relaxation for the kids.
Okay, sir. Thank you.
होम टेक्निक इसको हम कहते हैं हैंड ओवर माउथ एक्सरसाइज. See the phrase, if a normal child does not listen and continue to cry, hold a folded napkin or hand over child's mouth and gently and firmly hold his mouth shut. So this is hand over mouth technique. This is also a kind of physical distraction. You can putting your hand on the patient's mouth and then you're controlling her screamings and shoutings. So this is hand, but this usually came in the last tense because it's going to be physical. So जितने भी physical distractions हैं उनको हम usually end के लिए रखते हैं. We always take from the verbal, eye control, voice control, and then coming towards the physical distractions. इसकी कुछ contraindications हैं, like a child before 3 years of age, because we don't know the child is breathing through the mouth and maybe stop breathing. So we are supposed to be keep care for the child under 3 years of age. And emotionally and mentally handicapped child as well. These are the contraindications for the home technique, that is hand over mouth exercise. Then there are advanced behavior guidance in which you can use some analgesics, barbiturates, benzodiazepines for the sedation, and you also you work in those childs who cannot cooperate due to lack of their psychological or emotional maturity. So it includes, the techniques includes the protective stabilization, in which you can tattoo board use कर सकते हैं to bind the child on the board. Then you can use sedation, and then the GA, the general anesthesia. The protective stabilization is a Papoose board. You can tie the child on a board with the belts so that he cannot move his hands, his legs, and his head as well. You can see that everything is affixed. This is known as Papoose board. You can tie the child on the Papoose board so that during the work, his hands, legs, and heads don't move. You understand? This is kind of protective stabilization, Papoose board. Then sometimes when the parents are there and the child is small, the dentist can handle a child on his knees while his hands and legs are in control of his dad or mother, whoever is attending with the child. So this is another posture, like this is the dentist. So the child head is on the dentist's knees and his head is controlled by the dentist's hands as well. So the hands and the legs are being controlled by the father. Same goes for the legs. If you are doing the work, this is a dentist and the mother is holding the legs. So the child don't move his legs while they work. Because any movement when you are working with the high speed handpiece can be very fatal, because you are working in oral cavity and a slight change in millimeters can go towards soft palate, floor of mouth, and that can be a life-threatening injury. If you damage the floor of mouth and if you go towards the soft palate, everything is vital around. So we are supposed to keep care while working with the child. So for legs, you can see that these people are holding the legs and the assistant is holding the arms and the chest, and the dentist is working. While the child is watching a 3D glasses movie. He is wearing the glasses while he's watching his movie. So this can also distract. And for the teeth, obviously the mouth prop. If you don't have the mouth prop is usually a mouth opener in which if the child cannot close his mouth if you have the mouth prop in. This is kind of a lock you fix in between the teeth and the child cannot close his mouth. This is very important. अगर आप mouth prop नहीं लगाएंगे, and in any time of the work, if the child closes his mouth and you are working with your handpiece or any sharp instrument, that can damage anything around. That is the tongue, the buccal cheek, the lips, and the soft palate, the hard palate, and the floor of the mouth. So the mouth prop is mandatory while you're working with the childs, because they can move anytime, anywhere. So always, again, for hands, that Papoose board for hands, for legs, and for the teeth. This is the mouth prop. Then you can also give the pre-medication. The pre-medication definitely will include the benzodiazepines and the barbiturates. Like if you ever had take your child, any of your nephew's niece outside towards any doctor for any procedure, they have a simple solution of chloral hydrate that also sedate the patients, and the doctors while can work easily. The guidelines for giving the pre-medications or a detailed medical history. You should be aware of the child medical history. Is it clear, or he has some medical compromised status? So medical history is always very important before prescribing any drug or any medication. Before taking any medical history, it's a big blunder in the work if you give the medication without taking the medical history. And then decision making, which kind of medicine you want, and what level of sedation is usually required, how many sedation we want, how many doses required. This is also important depending upon the age, weight of the child. And then selecting an appropriate agent, which agent is appropriate in this condition. Sometimes we need just syrups, sometimes we depend upon the tablets, and sometimes we go with the IV or IM sedations. We'll talk about this in the further lectures, inshallah. And then the consent. The consent is being majorly taken by the father or the mother, the parental consent. And if there is no parents along, then the consent can be taken from the bigger brother or the sister. Then the training. That you are supposed to be trained off while working with this stuff. ऐसा नहीं हो कि आपने training नहीं ली और you are going with the sedative agents. So for the sedative agents, you are supposed to be well trained off, and your staff should be well trained. And extra assistance to monitor physiological parameters like the ABC, like the airway, breathing, and the circulation, like you study in the surgery. You're supposed to keep care of the following things. And while we are sedating the patients, we should have the pulse oximeter so that we can check the oxygen saturation of the child. And then the post-op care. When we are sedating the patient, the post-op care is different. Again, the sedation is coming in your future lectures. We'll talk about it. There are different types of sedation. Sometimes we give oral sedations, sometimes we give IV, and sometimes we give inhalation sedations. So sedation is of 3 different types. That is inhalation, oral, and IV. So the post-op care is also very important. Then the pre-medication sedation, like if the child is very anxious and you understand that the child will not allow you to work when he will come to the clinic, in these conditions, you are supposed to go with the pre-medication sedations, and that will include sedatives like phenobarbital, that will induce sleepiness, and can be barbiturates like phenobarbital. That can be benzodiazepines, and non-barbiturates like chloral hydrates, and the anti-anxiety drugs like benzodiazepines. So for sedatives, that can be barbiturates, and that can be benzodiazepines, and that can be non-barbiturates like a chloral hydrate syrup that is rapidly available if you ever go for any echo of a child or any procedure by some general doctor. And then definitely the analgesic. If the child is having pain, so if we give her the preoperative analgesic dose, that will help us to work more better, and the child will be feeling more better if we having a pre-analgesic dose that can be narcotics, it can act on PNS, and non-narcotics like methadone, ketamine, but the dose can be adjusted. And you are always talk before the pediatrician for the dose adjustment of the drugs, because the drug value is different from the adults, and these drug values are different for the child. in childs who definitely need less dose. And for any kind of the sedations, there are different kinds of dose. Again, we will talk about in the sedation topic, which kind of dose we usually recommend and which kind of sedation is usually required. समझ आ रहा है कि ऊपर से जा रहा है?
सर आ रहा है समझ.
श्योर? सबको आ रहा है?
यस यस.
किसको नहीं आ रहा? किसको नहीं आ रहा? Anyone? Be fair with yourself. If you are not understanding, please let us know. लगता है काफी समझ आ रहा है सबको. And then the sedation can be used safely and effectively in the patients who are unable to cooperate during the dental treatment. And these agents can be administered, like I previously told you, IV, IM, orally, or via inhalation. Sedation में और general anesthesia में क्या difference होगा?
सेडेशन में नींद आती है, जनरल एनेस्थीसिया में नींद नहीं आती.
Okay, good. सिर्फ ये difference है. और sedation में बच्चा अपना मुंह खोल सकेगा कि नहीं?
सर सेडेशन में पेशेंट कॉन्शियस होता है, मतलब लेकिन उसकी सेंसेशंस नहीं रहती. और जनरल एनेस्थीसिया में पेशेंट अनकॉन्शियस होता है, मतलब कंप्लीटली डेड.
Very good, Saad bhai. And what else? In sedation, the child will verbally respond to your questions. आप जो भी उससे पूछोगे वो उसको answer कर सकता है. He is conscious. He is able to open his mouth. His eyes are opened, and he can swallow the saliva. He can breathe well. And in GA, he cannot respond. He's unconscious, and definitely he don't know what's happening. He cannot able to open his mouth, close his mouth. He don't respond to your commands. But in sedation, the child usually respond the commands. The most common inhalation sedation agent is nitrous oxide, also known as laughing gas, in all around the Europe and the world. In Pakistan, we usually have very less setups which have the inhalation sedation setups. So it is colorless, odorless gas. It acts by GABA receptors, and it has analgesic and anxiolytic effect. Nitrous oxide को laughing gas भी कहते हैं. And it is colorless and odorless, and is most commonly used in Europe and all over the world. And it's for child, it's the most best one. It has 3 types of curves, like mild, moderate, and severe. We'll talk about in detail again. I'm repeating this for the 3rd time. When we go towards the sedation, we will repeat it. It increases the respiratory rate, the cardiac output is decreased, and produces an altered state of consciousness without impairing the motor functions. Like the child can respond and has verbal commands and open his mouth and close his mouth. He can swallow, he can inhale, what so forth. Other drugs that can be used for sedations, this is a list, take a short of it. That can be mepridine, that can be barbiturates, and that can be midazolam for oral sedation, and that can be diazepam for IV or IM sedation. कुछ समझ आया आपको?
Yes, sir.
Okay, this is the difference between the conscious sedation and the general anesthesia. In conscious sedation, the treatment can be done in several appointments, but while in GA, the whole treatment can be done in a single appointment, because we cannot go with the GA every time. Sedation can be used in cooperative patients who are anxious and fearful, and the GA is for uncooperative patients. In conscious sedation, as the word indicates, the child is conscious, but in GA, the child is unconscious. The reflexes and the airway is maintained in conscious sedation, and reflexes are lost, and the ventilation is required for the GA. For GA, we have specific protocol for the empty stomach at least 6 hours before the procedure, and for conscious sedation, the patient needs not to be starved. You can go it with any time on the go. जनरल एनेस्थीसिया हम उन पेशेंट्स में अडॉप्ट करते हैं जो कि हमारी बिहेवियर शेपिंग और बिहेवियर मॉडिफिकेशन को अडॉप्ट करने से फेल हो जाते हैं, एंड द कॉन्शियस सेडेशन विल नॉट इम्प्रूव एनी रिजल्ट्स, सो देन वी आर सपोज्ड टू मूव टुवर्ड द जनरल एनेस्थीसिया. जनरल एनेस्थीसिया कब देंगे और किन पेशेंट्स में देंगे? मेरोज?
जी सर, अब आवाज आ रही है?
हाँ जी, आ रही है.
जी सर.
जीए हम किन पेशेंट्स में देंगे?
जी हम उनमें ले सकते हैं जो बहुत ज़्यादा पेशेंट एंशियस होते हैं या कोऑपरेटिव नहीं होते बहुत.
अनकोऑपरेटिव के अंदर देते हैं ना, वो अनकोऑपरेटिव
Yes.
और जो हमारी बिहेवियर शेपिंग को फॉलो नहीं कर पाते थ्रू अ स्टेप ऑफ द प्रोसीजर, वो यूजुअली फॉलो स्टार्टिंग फ्रॉम द स्टार्ट, टेल शो डू, मॉडलिंग, डिस्ट्रैक्शन, वॉइस कंट्रोल, एम्पैथेटिक कंट्रोल, कॉपिंग, एंड जिनके ऊपर हम सब कुछ ट्राई कर चुके हों एंड दे आर नॉट रिस्पॉन्सिंग टू एनी ऑफ द स्टेज, एंड देन वी आर सपोज्ड टू मूव टुवर्ड द जनरल एनेस्थीसिया. And there are certain contraindications for the general anesthesia. The most and the foremost is the cooperative patient. If the child is cooperating, then why we are going towards GA? The general anesthesia is contraindicated for a healthy and a cooperative patient. And any medical condition that has been interfering with the general anesthetic agents is also a contraindication for the general anesthesia. How many of you are in favor of GA, and how many of you have seen conscious sedation ever in your career up till yet? किसी ने देखा है conscious sedation का पेशेंट होते हुए?
No, sir.
No one?
No, sir.
No, sir.
कॉन्शियस का
देखा हो?
Conscious sedation can be simple with IV. किसने देखा है?
सर मैंने
असद ने?
जी सर.
क्या देखा असद फिर?
सर आर्च बार वगैरह लगानी थी, उसमें जो है वो सीडेट किया था.
ओके, कौन सा सेडेटिंग एजेंट यूज किया था?
सर ओपियोइड था.
In Pakistan usually we don't have any center for inhalation sedation. यहाँ पर जो भी sedation हुई होगी, that will be definitely the IV, IM or oral. Inhalation के लिए एक proper setup चाहिए होता है, इसके अंदर हमें proper meter चाहिए होता है, and there is no setup available for inhalation sedation in Pakistan yet. There are two centers in Lahore which usually do the sedations, and probably you have no those centers. If no, then I will let you know. Do you have an idea? कौन करता है? असद कहाँ से करवाया था?
सर इनहेलेशन तो नहीं, आईवी करवाया था.
Yes, IV की बात ही कर रहे हैं. Inhalation का तो सेटअप ही नहीं है अभी यहाँ पर किसी के पास.
सर वो खुद ही किया था.
That is very good. हाँ, खुद कर सकते हैं. ये मैं पूछना चाह रहा था. हाँ. लेकिन उसके लिए साथ आपको BP operators and hospital acquired setup mandatory है. Even if you are going yourself, you cannot go beyond the hospital setup for the sedation because you need a lot of operators for the ECG monitoring.
Sir.
जी जी.
सर ये जो हमें चिल्ड्रन के साथ तो काफ़ी ऑफनली डील करना पड़ता होगा, और उसमें ये चीज़ काफ़ी नेसेसरी है बिकॉज मोस्ट ऑफ द पेशेंट्स जो बच्चे होते हैं वो काफ़ी ज़्यादा एंग्शियस होते हैं.
Yes.
तो ये एक नेसेसिटी नहीं है हमारे पास कि हमारे पास होनी चाहिए ये कॉन्शियस सेडेशन.
But definitely होनी चाहिए, और actually we should have an anesthetist in the team. Actually जो Periodontics है, that is the MDT. It's the multidisciplinary team. इसके अंदर एक सिंगल बंदा काम नहीं कर सकता. We always need a multidisciplinary team जिसके अंदर एक anesthetist भी हो और हॉस्पिटल का OT स्पेशलिस्ट भी इंक्लूड होने चाहिए. Who can keep care for the lot of things. It's not about to sedate. It's about to know the vitals of the child. Say how he or she is behaving while we are working
Yes,
on it.
Okay, sir.
So the steps in the hospital procedures It includes initial examination and the parents' discussion. In the initial examination, you saw the condition of the mouth, pulpectomy karni hai, whatever we are supposed to plan for, and then the consultations with the anesthetist and the other members of the team. Then the patient को admit करते हैं, क्योंकि hospital setup में कभी भी हम बगैर admission के काम नहीं करते, because we have to keep the child starved for 6 hours before, so we are allowed to take the patient admission. And then the pre-operative procedures, like उसको हमने भूखा रखना है, no feed for the first 6 hours. Then the pre-operative preparation, उसकी preparation करने के लिए, and then anesthesia induction, that will be definitely done by an anesthetist. And then the dental treatment procedure after anesthesia, उसका वो procedure करेंगे, and then उसको anesthesia से out कर post operative procedure, like when we are out from the anesthesia, then we need stabilization time to get stabilized patient, so उसको हमें फिर room में shift करना पड़ता है, and then discharge and follow up. This is end of your lecture. जी कुछ बोल रहा था कोई? And then last, the agents used for the general anesthesia are the Sultan, enflurane, isoflurane, desflurane, and sevoflurane. But ideally, this all should be done and monitored by an anesthetist. Being a dentist, we are not. This is not our specialty, and we cannot go with the general anesthesia ourselves. अब आप मुझे बताओ कि पेरेंट्स को ऑपरेटरी में बुलाने के क्या-क्या नुकसान हैं? उमर? Umair, can you hear me?
जी सर.
पेशेंट्स को ऑपरेटरी में बुलाने के पेरेंट्स को क्या-क्या नुकसान है? अगर if we call the parents of a child in an operatory, what are the disadvantages? Umair?
सर मुझे नहीं आता सर, मैं अभी वॉशरूम से होके आया हूँ.
अच्छा, anyone else? कोई और बता दे, पेरेंट्स को ऑपरेटरी में बुलाने के क्या नुकसान हैं? What are the disadvantages?
अनकम्प्लायंट पेरेंट्स हो सकते हैं, बच्चा पेरेंट्स को देख के काम नहीं करवाने देता है.
They interfere, they intercept the order, they repeat the order, and then
attention से divert होती है
yes,
बच्चे
the
की.
child attention can be diverted and the
dentist की भी.
Yes, good. So what are the different behavioral shaping steps? हम किस तरीके से उसको shape कर सकते हैं? Starting from the least invasive towards the most invasive. The first step is tell, show, do. And then what is modeling? Modeling में हम क्या करवाते हैं?
Modeling के वो एक same age के patient को दिखा रहे होते हैं और दिखाते हैं कि it's not a painful procedure और ताकि वो prepared हो जाए उस procedure को perform.
And then what is distraction?
Distraction इसमें ये होगा कि थोड़ी सी harsh voice use करनी पड़ेगी अगर थोड़ा सा.
So for distraction, we are supposed to have some background music. We are supposed to have some cartoonic movie, and we should give the child the 3D glasses so he can watch his movie while we are working. We are distracting the child. Harsh voice में हम उसे distract नहीं करेंगे. That is the voice control. जिसके ऊपर हम उसे command कर रहे हैं. We often appreciate the good response, and we are usually neglect the bad response. हमें bad response को neglect भी करना पड़ता है. And what is the home technique?
सर नैपकिन से पेशेंट का माउथ कवर करते हैं.
Hand over mouth exercise is a home technique. Hand over mouth exercise. Yes, napkin cover करते हैं so that we can control. और अगर बच्चा बिल्कुल control नहीं हो रहा और बहुत ज़्यादा movements है तो फिर हम क्या use करेंगे?
voice technique use करेंगे.
नहीं, अगर बच्चा की बहुत ज़्यादा movements हैं
support
sedation
technique.
वो
Conscious sedation.
क्या यूज करेंगे?
Papoose Board.
sedation.
Papoose board, if it's moving too hard, then we are supposed to tie the child with the bells on the Papoose board so that he cannot move. और दांतों में क्या यूज करेंगे while the working?
Mouth opener.
Mouth prop.
Mouth.
I hope you understand. We have less than a minute now, and inshallah, if you have any query, we can repeat it back again. First, let us finish with the work. Actually, the periodontics is going to be the separate domain as a new specialty all over the world. अभी तक ऐसा नहीं है. It still fall in operative dentistry according to the Pakistan Medical and Dental Council criteria. But soon or later, it has to be a separate specialty. In Pakistan, Islamabad PIMS Hospital, there's going to be an MDS program who are dealing with periodontics, and certain other people are trying to make it a separate individuality as a separate subject in the final years.
सर ये कहाँ से कवर करना है, किस बुक से?
ये आपकी बुक वैसे तो वल्बरी है, periodontics की बुक का नाम है वल्बरी. We'll share the book in the group with you guys, the Wulberry. There are certain other big books known as Pinkham, but they are McDonald and Every, but they're bigger books. So we recommend go with the Wulberry, and we'll try to share the lectures. Because actually the periodontics, you have only 1 or 2 SCQs from your TOS. So आपने उन 1 or 2 SCQs के लिए इसको cover up करना है. And we'll let you know the important topics once we are finished with the lectures. कि इसमें कौन-कौन सी चीजें important हैं. हम TOS के accordingly, inshallah, we will be guiding you.